Hi, my name is Jami. I'm 16 and today I feel nervous. I chose the mask because it makes me feel pretty. I like how all the colors combine into each other and it just makes me feel my personality, like all the colors combining together is my personality. When I was in my 8th grade year of middle school, I ran away because my sister had died recently. My grandma had died as well. They died probably about 10 days apart. My sister, she got murdered by her boyfriend, and that was really hard for my family. I had thoughts of suicide. When I ran away, I was scared, I got depressed, I worried, and I didn't know what to do with myself.
Jami's story is similar to stories I hear all the time. A lot of teenagers, at least, are seeking confidential treatment. See a lot of patients that are experiencing suicidal ideation, severe depression, anxiety, panic. There are not that many options for them for that. And I know that if they're not coming to our clinic, they're probably not gonna go anywhere and not have anybody. Last year, 16, 17-year-old boy, he was not attending school. He was skipping school almost every day, not sleeping well, and I think using some substances, was feeling really depressed. And he would show up. He'd show up to the clinic, he'd make an appointment. I was amazed at his sort of level of engagement. He said a couple things that I will always remember. The first was, I asked him, how has it been to talk? And he's like, oh, it's hard, but it's you're like a tour guide for my mind and my heart. And you kind of guide me and okay, let's go here. It's gonna be okay. Let's go here. And he's like, I wouldn't have been able to do that without you. Yeah, it makes me feel teary just talking about it. It's always the doorknob moment is what we call it. The doorknob moment's you're saying goodbye and then a patient or client often says something really surprising or profound right before they leave. And so we were saying goodbye and he turns to me and he's like, I want you to know that I'm taking a lot better care of myself now. Yeah, and he was a kid that didn't have any adults watching out for him. So those are the wins. To be able to work with patients and talk about and get to some of their most deepest worries and fears and experiences is really an honor to me, and I hold that role with great care. It's just, yeah, it's cool. It's just super meaningful, and the patients are amazing.
I'm in a better place now. I am. I went to a mental and behavioral health center and I learned I could be a better person and that I could have more resources to help me with my stress and my anger. They gave me art as a tool. They gave me deep breathing. Deep breathing helps me relax a lot. I found my voice to fight for my rights, just be there for people who need it. I finally feel like I can try my hardest. It's okay to be real. It's okay to be you.
This is one of the many examples of why SBHCs are important. SBHCs are unique because we can see any patient regardless of their ability to pay and regardless of insurance type or if they have insurance at all. And that's really awesome so that we don't actually say no to anyone. So we'll see any students within the high school and then any students who go to the feeder schools of the high school. So that could be the middle schools or the elementary schools. And then we'll also serve any siblings of those students within any of those different schools. So elementary, middle, or high school. So about 2,400 kids a year. The volume is very high, yeah. NHC currently is managing 2 school-based health centers in Washington County, and there's absolutely a need for more school-based health centers. There are some school districts in the Tri-County area who have no SBHCs, and I can't imagine where those kids in need are going to get services.
We all wear masks every day. We hide behind them.
This is what I really want you to know.
It's okay to be real.
About how you feel.
And it's okay to have the feelings that you have.
It's okay to get help.
It's okay to be real. It's okay to be you.
It's okay to speak your truth and talk about mental health.
Be real, be well.
Oh, that was a total tearjerker. My gosh. To know that I'm providing care to people that otherwise likely wouldn't be getting a well child visit or that care anytime soon is immensely rewarding to me.
I love teenagers and I think they're fascinating. It's a difficult time of life and it's also a really exciting time of life. I think it's really hard, especially if there have been adults or just people in their lives who have broken their trust or made them really feel like they can't rely on other people.
And a lot of kids that I care for at the school-based health center feel like they're forgotten. Feel like they're forgotten by society. A lot of them can't articulate that they feel forgotten about by the healthcare system, but the reality is they are. So school-based health center support is vital for the care of those most at risk in our communities.
It can be challenging because more and more kids will learn about us and more families will learn about all the resources that we can provide. But then sometimes the need is a little overwhelming and we have to try and figure out, are there enough of us to provide the needs for all those families who need us?
Without support, school-based health centers aren't going to be able to provide very vital services to a population of kids that is often very underserved. And for all of those reasons, we're so grateful for your support. You're invited to watch all of these student stories in full on NHC's media channels. On behalf of NHC, our patients and families, thank you.